Remember to subscribe, and hit the bell icon, to never miss an update from Dr. Mike Baby Care Channel.
Your pregnancy. Week 13. Congratulations! The end of week 13 is the end of the first trimester. Welcome to the second trimester of pregnancy, a trimester of growth where your bump will get bigger and you'll start to feel your baby moving. You're hopefully through the worst of your symptoms and the risk of having a miscarriage has plummeted. This is the glorious second trimester. Enjoy it. Your baby's development at 13 weeks. At 13 weeks, your baby is as big as a lemon. While baby's eyes have arrived, they're not open. His eyelids are fused shut to protect those tiny peepers as they continue to develop. The promise of laughter, cries and very first words start now with the formation of vocal cords. Your baby has started swallowing amniotic fluid and excreting urine, which she then swallows, recycling the full volume of fluid every few hours. Hair follicles have already started developing and soft, fine hair called lanugo is beginning to appear. 13 weeks pregnant symptoms. Now that you're 13 weeks pregnant, you should be feeling pretty good soon. After all, the second trimester doesn't get its reputation for being the honeymoon period for nothing. But if you're not feeling better yet, don't worry. While most early pregnancy symptoms will probably be behind you soon, some women find that nausea and fatigue linger into the 4th and even 5th months. New symptoms may also arise as your pregnancy progresses, such as increased sex drive. If you're one of those lucky pregnant women who is experiencing an increase in sex drive around this time, enjoy. You and your partner can use your increased sex drive to enjoy some together time before baby arrives. Visible veins. Though you may not find these veins a welcome sight, they're actually a good thing. Your increased blood supply is carrying much needed nutrients to your baby. And good thing is, these veins will fade after you give birth. Making colostrum. You can't feel it, but your breasts may have already started making colostrum, the nutrient-rich fluid that feeds your baby for the first few days after birth, before your milk starts to flow. Increase in energy. The second trimester is known as the least symptomatic and the most energetic. As you start to feel more like yourself and get that energy surge, you're going to want to knock a bunch of to-dos off your list. Exercise will only benefit you and baby and can even make labor easier. Totally worth it. Food cravings and aversions. If you still have a thing for weird foods, don't be too hard on yourself. Do your best to find healthy foods that appeal to you and give yourself permission to indulge in small portions of the junk foods you crave. Pregnancy checklist at 13 weeks pregnant. Learn how to eat for 2, make those calories count. Know the signs of urinary tract infection. If untreated, it can potentially travel to the kidneys and pose a health risk for mom and baby. Strengthen your pelvic floor by doing Kegel exercises. It can help during labor and lead to a faster post-birth recovery. Consider your choice of doctor or midwife to be sure they are the right fit for you and your partner. It is the end of the first trimester. In 13 short weeks, your baby has grown from a tiny combination of an egg and a sperm into a fully formed little human. The chances of having a miscarriage decrease once you enter the second trimester. Many people therefore decide to share the news of their pregnancy at this time. Next week brings a big pregnancy milestone. It may mean some relief of your early pregnancy symptoms and a boost of energy. So rejoice. Thank you for watching. Don't forget to subscribe.